am Dr. J.M. Dua. I'm a senior consultant in the internal medicine department in Indraprastha Apollo Hospital, New Delhi. Well, I'm giving a short message to my colleagues, all juniors and others also, especially those who are in the new in practice or they have joined their courses in their future career. Just to tell that a little bit on the hypertension, important topic because this is a very, very common problem. Of course, you all hear about diabetes and all, but blood pressure is more common and it's there for all of you have read. I just introduce a few things. I'll just tell you something which is out of the way, and that is few points which are important that if you go for the WHO data, if you have heard it or you have otherwise you just come to deaths in India, 63% are from non-communicable diseases, not from communicable, non-communicable, which are like diabetes, they are high blood pressure, asthmas, and other so many diseases. 63% of them are non-communicable, out of which 27% are the cardiovascular deaths. And more out of cardiovascular deaths are because of not ischemia, but because of hypertension. Now, in the age group, if you take a little middle age group, 40 to 69, 45% are due to hypertension. And if we just take a epidemiological study of people more than 30 years of age, you will find that 38% in females and 38% in males rather, and 32% in females, they are having this hypertension, out of which 50% of the persons, they're not out of it. They just come to know on routine checkups for some other reasons or even for epidemiological study. You'll find that they are not aware of their high blood pressure. And out of them, naturally, because they are not aware, many of them in the blood pressure cases, 62% in the males and approximately 53% in the females, they get no treatment. Thereby, in the worldwide studies, if you find 1 in 5 and 1 in 4, they are not even on treatment for regular times. In the society, there is a society by the name of Interstitial Society of Hypertension, which is on the global, they give the global guidelines. Even this American Heart Association, American Cardiological, that American College of Cardiology, that in 2021 new guidelines also, they suggest few things. That if stage 1, in where the blood pressure is 130 to 139 systolic, oblique 80 to 89 diastolic, they say there's no need of starting the treatment straight away. And because there's a lower risk of atherosclerotic cardiovascular disease, the risk is low, you can go for lifestyle treatment to begin with and wait for 3 months, maybe maximum 6 months, and see if they're controlled or not. If they're not, then you can start the treatment. But try to minimize the blood pressure to practically 110 to 120 systolic and 70 to 80 diastolic. Patients in where there's of late, you might have heard of, because of COVID, there's many people who had this problem and they went into acute respiratory distress syndrome, ARDS. The guidelines says, I'm telling you extra which are away from the usual one in certain conditions like COVID and ARDS. The metoprolol use is also recommended because that decreases the lung inflammation and increases the lung functions. In blood pressure monitoring, if you go for ambulatory blood pressure monitoring, people working, or even home blood pressure monitoring for 24 hours, it is seen that a rise of 20% systolic or 10% diastolic, the risk of death increases by 23%. And cardiovascular disease problem increases by 36%. So that is the importance of this ambulatory and home monitoring blood pressure, to start the treatment at the early possible to detect the hypertensive patient and then to start them also. In one more thing I would like to point here is that in European guidelines of 2018, they have suggested that one can even start combination, especially dual antihypertensive treatment to begin with also if they find the blood pressure is quite high. And the combination therapy, they recommend one of the drug is AC inhibitors or ARB plus calcium channel blockers or diuretic. That combination holds good to bring the blood pressure down fast. And in the last a minute or so, I would like to tell that in July 18 also, it was said that valsartan was recalled. Valsartan, which was very famous antihypertensive, was recalled because of presence of NDMA, which is a carcinogen, which is N-nitro sodium methyl lamina, and that increases the presence of cancer by almost 8 every 1 lakh, and liver cancer is also increased. Then there's a HIGA study which tells that if you follow the number of patients for some time, by your risk is definitely decreased significantly. So my whole idea of telling is that please take your regular checkups for, and if you're hypertensive, take the medicine regularly. Thank you very much.